attending. You guys know CME is available for this. I'll put the link in the chat during the talk. But I want everybody to meet Dr. Beth Weinstock, who is a physician and a mother of four, whose eldest son, Eli, died in March of 2021 when he unintentionally ingested fentanyl. My son and Beth's son grew up together, and Eli's death was utter devastation to our entire community. In honor of Eli, Beth and her daughter Olivia founded Birdie Light, which is an organization dedicated to ending the loss of young people due to the dangers of illicit fentanyl. Dr. Weinstock recently retired from Equitas Health in Columbus, where she cared for individuals infected with HIV and hepatitis C in order to focus more exclusively on Birdie Light. She and Birdie Light have been featured on multiple podcasts, news outlets, and on The Lead with Jake Tapper on CNN. Her organization has spoken to thousands of high school and college students, as well as public health and parent groups across the country and here in Central Ohio. Dr. Weinstock is here today with the information and tools you can use to keep yourself and your community closer to safe. Thank you so much, Beth, for being here.
Thank you, Mary Lynn, for that great introduction. And thank you, everybody, for attending today on what seems to be the most beautiful day of the entire winter. So I realize you could be outside eating lunch even, which is strange for February, but thank you for listening. As Mary Lynn mentioned, we're here today because something horrible has happened, something unimaginable. And that thing happened to my family. It happened to my son, Eli. And it's happening to countless families across this country every single day. So I want to acknowledge first that what we're talking about today is a heavy, serious topic. And I hope that what you can leave this 45 minutes with is some tools and thoughts on how you can keep your patients safe and how you can keep your family safe. And I'm here, of course, so you can learn about Birdie Light, which means learning about fentanyl, which means learning about my son, Eli Weinstock, who died in March of 2021 while a sophomore at American University. Eli was a kid just like any kid. He graduated from a high school here in Columbus. He played on the tennis team. He loved filmmaking, and he made a lot of creative films with his siblings as cast members. He loved cooking. He loved Grater's mint chocolate chip milkshakes. He loved his friends and his family. So that word fentanyl is not the word by which I would want you to remember my son, in the same way that you would not want to be remembered only for the weapon that caused your death. Or for the last hour of your life. I don't want Eli to forever be associated with fentanyl. Next slide, please. So what is the right word? I like to think the right word is big-hearted or kind-hearted, which my son most certainly was. And we lead our efforts with Birdie Light with a big, kind heart. We only come to speak to you today in an effort to save lives and to enlist you as providers and as family members to fight in Eli's name, because every day we wake up in my family and fight in Eli's name. And I think that one of the most powerful tools we can enlist to join us are healthcare providers. So I'm going to tell you the story of Birdie Light, which is a new story, because for my family, all stories started anew or started over on March 3rd of 2021 when Eli went home to get ready to go out with his new fraternity brothers in Washington, D.C. Eli had a 3.7 GPA. He had just lined up a great internship for the summer. We had just seen him 10 days before he died in Florida. And the interesting thing is that Eli was not struggling with a substance use disorder or addiction. In fact, Eli's decisions every single day were future oriented and probably the correct decisions 99% of the time. But within an hour of arriving at his home, he had collapsed and died from an accidental fentanyl ingestion. The only other substance found in his body that day turned out to be kratom, Kratom, which is a legal plant-based supplement that is sold in head shops and CBD stores in Ohio and in Washington, D.C. We don't know if Eli thought he was taking kratom and it had fentanyl in it, or perhaps he took kratom separately and then thought he was taking a different type of substance, like a counterfeit pill that just had fentanyl in it. We probably will never know. But regardless, I want you to imagine or think back, recall any bad decisions you might have made between the ages of 15 and 35. And it doesn't have to be drug or alcohol related, or maybe you just saw friends of yours or peers who made bad decisions. And I get that. I totally get that because I made my own really bad decisions during those 2 decades. But the difference for this generation currently, for Eli's generation, is that the stakes are so, so, so much higher than they used to be. And I hate that for this generation because, as you know, for this generation, for young people, we are never going to stop young people from making bad decisions or being impulsive. In fact, as you know, developmentally, it's normal for young people to be impulsive or to experiment. And we all hope as parents or healthcare providers that a tattoo or a change in hair color or really loud music is as risky as it gets, but that's not always the case. Next slide. So here we are in 2023, and this slide's getting a little old at this point, but we can see the trajectory, and this has not changed since this slide was updated at all. In fact, that blue line that you see skyrocketing off that graph has continued to increase year over year. Last year in America, we lost 108,000 individuals to a drug-related fatality, and that's the highest number ever recorded on American soil. 108,000. I think the OSU football stadium holds 104,000 people. So just for comparison of how many individuals we lost in 1 year alone in 2021, just due to a drug-related fatality. And over 75% of those fatalities were due to fentanyl alone. So over 75% in 2021 were due to fentanyl alone. And if we look at this graph, you can see that in 2015, it was only about 15% of all drug-related fatalities. So if you follow that blue line heading dramatically up the graph, that's only fentanyl. It doesn't contain other opioids like heroin or prescription opioids, which are included in the other colored lines on the graph. And I want to be clear, like, as a grieving mom, as a physician, as a representative of Birdie Light, I sometimes struggle with the word overdose because I think when we use the word overdose frequently, we tend to imply that the person who was ingesting the fentanyl on the day of their death was accustomed to dosing the fentanyl regularly, and that on the day of their death, they just happened to take too much. Well, the truth is that most Americans in that blue line right there had no idea they were taking fentanyl that day. So I'm not clear on what the right word is. I hesitate to use the word murder or poison because, as we know, sometimes those words are used to trump up or increase felony charges against perhaps low-level drug dealers who may have no idea that what they're selling has fentanyl in it. So I don't know what the right vocabulary is, but this is happening right now on the scale of over 200 Americans per day in our country. Next slide. Let me make a couple striking comparisons for you. So on the left is the greatest public health crisis of my generation. And at the peak of that crisis, the HIV and AIDS crisis, at the peak in 1995, we had lost in a 12-month period about 42,000 Americans. That was at the peak. And I line these two slides up intentionally, not because it looks pretty, but because you can see on the right, for drug-related fatalities, in January of 2015, we were already above the 40,000 mark and climbing to the current 108,000 right now. So that's a striking comparison. Let's look at one more. Next slide, please. On the Vietnam War Memorial Wall in Washington, D.C., which was a war, of course, that killed young people, primarily men, just like the fentanyl crisis. At the peak of this war, or I'm sorry, at the total of this war, we lost 58,000 Americans. And that's for an entire war that lasted nearly 10 years. Next slide. Sometimes when I go to speak to young people in high schools and colleges, I'll share these slides. So I wanted you to see them too. Some pop culture references of people we have lost to the fentanyl crisis. This is Mac Miller. And a few years back, he ingested cocaine that he was unaware had fentanyl in it. And he died from the dose of fentanyl that was in the cocaine. Next slide. Prince was accustomed to taking opioids on a daily basis for chronic pain. And on the day of his death, he was given a hydrocodone that was counterfeit. And unbeknownst to him, it had a lethal dose of fentanyl in it. Next slide. This is Lil Peep, who was a favorite of my son. Lil Peep also on the day of his death was ingesting what he thought was a Xanax, but it was a counterfeit Xanax, and it had a lethal dose of fentanyl in it. These three, famous individuals are just one of countless people that we've lost that are musicians, artists, actors, but of course, it's affecting young people across the nation from all walks of life. Next slide. So 6 months after my son died, his sister, Olivia, who is 23 and lives near me here in Columbus, we sat by his gravesite and we said, these numbers are staggering and it's our imperative to do something about it. Because right now, you may realize this or not, but right now there is no standardized curriculum in any high school or any college across this country for fentanyl education. There is no standardized education that is given in medical schools to teach healthcare providers how to keep people safe from fentanyl. Because also, we don't lose this many young people to cancer, to COVID, to car accidents. Nothing gets close except suicide rates approach the number of people that we are losing to fentanyl right now, but do not exceed the number in this age demographic 15 to 24. I would argue this is the greatest public health crisis of their generation, and the magnitude of the loss is so hard to convey. And I plan to talk more just in a second about fentanyl, what it is and why it's so ubiquitous in our drug supply. But I also want to say that at times I feel a lot of rage about this issue, a lot of anger, as you can imagine, because when we look back on the greatest public health crisis of my generation, that in 1988, when we had lost 15,000 people due to complications of HIV, the federal government, the Surgeon General, sent a flyer to every mailbox in the United States warning of the dangers of HIV and how to stay safe from it. Every mailbox in the United States. Where is our fentanyl flyer? I also want to point out that at the peak of the Vietnam War, when we were losing so many American young men to that crisis, there were protests on nearly every campus in this country. Where are our protests? And I don't know the full answer to these questions, but I do like to point out that I think it's because of stigma. We like to stigmatize people that are associated at all with opioid use or illicit drug use. We like to think of fentanyl as it relates only to heroin use, and we like to keep that out there, outside of our communities, our schools, or our families. But the truth is that right now in this country, we don't just have an opioid use disorder crisis that has been going on now for 2 decades, and perhaps the public or even healthcare professionals have grown weary of. But right now in this country, particularly in the last 5 years, we actually have a poisoning crisis that is running in parallel to the opioid use disorder crisis. And perhaps there's a lot of crossover, and I know there is, but I think that we need to address this poisoning crisis head on without the stigma that we have sadly always reserved for anyone associated with opioids. And I want to say too that my daughter and I alone aren't going to be able to ever stop young people from experimenting with substances. I'm not certain we can do that. And I do believe the Just Say No to Drugs campaign has worked for some kids, but the numbers I've shared with you don't lie. And we decided there has to be a new approach, a honest and big idea kind of approach. So what we do, instead of making the campaign that perhaps we need to stop, close the southern border, or we need to stop China from shipping chemical precursors of fentanyl into our country, what we decided to do was to begin to create spaces where young people can learn about fentanyl, about drug adulteration, and about how to keep themselves and their friends safe. And it's important that I tell you also that we plan to get this education in the hands of any American young person who needs it. We want this conversation to become as commonplace as the conversations we have with our patients and our kids about sunscreen, about vaping, about seatbelt use, safe sex, other substance use. This needs to become so commonplace that we don't really think about it anymore. It's almost like the concept of a designated driver became so commonplace in the 1970s and 80s. Next slide. So what Birdie Light does is we try to occupy this middle space where young people perhaps haven't used a substance yet, or perhaps they're using substances like pills or powders recreationally. What we found is there's so many great people doing good work in the substance use disorder addiction space. And because that's already happening, we realize there's no one really getting in front of young people in this middle ground before they've tried a substance that might have fentanyl in it. So what we chose to do is to go high school to high school, college to college, maybe even small groups like fraternities, sororities, healthcare providers, church groups, youth groups, and we just speak to them about what they can do in this middle space to stay safe from fentanyl. Because as we strongly believe, and I'm sure you agree, that a young person who tries a substance or occasionally uses a substance doesn't deserve to die. A young person who is struggling with a substance use disorder or opioid use disorder and using those substances daily doesn't deserve to die. Two young men who try cocaine for the first time on the rooftop of their new apartment building after graduating from college don't deserve to die, but that happened to two young men from Cincinnati. A young man who orders a Xanax from Snapchat, which isn't really a Xanax, and the friend on Snapchat isn't really his friend, doesn't deserve to die, but that is happening quite frequently. Again, we would argue no one who uses drugs for one time, once a month, or every day deserves to die. Next slide. And here's what young people are telling us when we survey them. This is age 16 to 25, actually. About 50% of them are aware that fentanyl can be present in fake or counterfeit pills. And I'm going to define what counterfeit means in just a second. And also about 50% are aware that fentanyl can be present in cocaine. The scary number that goes along with that is on a few of our surveys, as many as 1 out of 5 or 1 out of 6 young people between the age of 16 and 25 have told us that since age 16, they've tried a stimulant such as cocaine or another person's Adderall. Now, another data point that goes along with that that makes it more terrifying is that right now in Ohio, about 18% of all cocaine has fentanyl in it. And that's pretty consistent in other states as well. So there's this huge knowledge gap between the number of young people trying stimulants the number of people who know that fentanyl can be present in cocaine, and also that 18% number of the amount of cocaine that does actually contain fentanyl. Next slide. And about 96% of young people who we survey say that before we spoke to them, they did not know how to stay safe from fentanyl or how to use a fentanyl test strip before we talked to them. Next slide. So let's just do a quick review of what fentanyl is. I know all of you already know a lot about opioids and fentanyl in particular, but just a quick review. As you know, opioids come from a poppy plant. Opioids can be either legal or illegal, depending on how they're classified. But there are two unique things about fentanyl. One is that fentanyl is both legal and illegal, depending on where it's made and where it's circulated. Also, fentanyl is unique because it's a synthetic opioid, meaning you don't need a poppy plant to make fentanyl, which also means you don't need a growing season or agriculture to make this opioid, which means it can be made pretty much anywhere from a few cheap, simple chemical ingredients. Now back to the illegal versus legal. So a poppy plant can be harvested, the sticky residue can be harvested and made into legal opioids such as oxycodone, hydrocodone, hydromorphone, and morphine. That sticky residue can be harvested and made into illegal versions of those opioids as well as heroin. So fentanyl in any form is known to be about 50 to 100 times more powerful than morphine. So it can create a euphoria that's way past morphine or even heroin. It also, because it creates such a powerful euphoria, there's this razor thin margin between that euphoria and a loss of consciousness, which subsequently can mean the loss of a drive to breathe. Now, let's talk about legal fentanyl, hospital use fentanyl, or cancer pain fentanyl. So you know that fentanyl's been around for a long time, I think since the 1950s, and it's been used in various mechanisms to control pain during or after surgery, during procedures, also currently used frequently for procedural sedation. You might get fentanyl when you have a colonoscopy. Last summer, my daughter broke her arm and she got intranasal fentanyl at Children's ER so that they could reduce the fracture. So fentanyl is commonly used and very safe in a hospital setting. But the difference is that that fentanyl is used on a level of micrograms, whereas illicit fentanyl in the circulating illegal drug world often is distributed on the level of milligrams, so 1,000 times stronger. And also, as you know, the difference in a hospital is they have oxygen nearby, they have naloxone nearby, they have a pulse ox, which of course is missing in the illicit or illegal drug world. Next slide. So the DEA distributes this slide, and basically it's used to illustrate the lethal dose of fentanyl, which is considered to be on average about 2 milligrams, and that's what they're showing here. So this amount of powder, because it's cheap, because it creates that powerful euphoria, this amount of powder can be slipped into other pills, other substances, and create that high level euphoria that sometimes people are seeking, and sometimes they have no idea that this is present in the substance they're taking. Let me list for you all the current substances on the illicit drug market that can contain fentanyl, and it's pretty much everything, but I'll just name it for you. So heroin. Illicit fentanyl has been present in heroin since the early 2010s, and actually pretty much all heroin on the market right now does contain fentanyl in some capacity. But the other substances also included are counterfeit pills, such as counterfeit oxycodone, counterfeit Xanax, counterfeit Adderall, and I'm going to show you pictures of all those in a second. Also, ecstasy, also known as Molly, which some people use at music festivals and parties. Ecstasy or Molly can contain fentanyl. Cocaine, I mentioned, it's very frequent. Like I said, about 18% of the cocaine right now has fentanyl in it. And cocaine is wildly popular on college campuses right now. The last one I didn't mention was methamphetamine, which the fatality rate from methamphetamine use had slowed down quite a bit, but in the last 5 years, it's skyrocketing again. And methamphetamine related fatalities have skyrocketed in the last 3 years, mainly due to adulteration with fentanyl. So next slide. This is a slide of counterfeit oxycodone. The fake pill is on the left and the real oxycodone is on the right. So in the illicit drug market, this is known as an M30, and this is probably the highest level circulating counterfeit pill in the US right now. So M30s are pressed and colored to look exactly like the real thing. But the slide on the left may have some oxycodone in it, probably some chemical fillers, who knows what else. But about 20% of the time right now in America, these counterfeit oxycodones will have fentanyl in them. My understanding is that a pill press is fairly cheap and easy to obtain. And as you can imagine, a young person who has purchased or borrowed or gotten somehow a M30 and wants to take it, they might Google this pill to see if it's the real thing. And of course, this is going to be very deceiving if they look at pill pictures online. Next slide. So on your left here is a counterfeit Xanax bar, and on your right is a real Xanax bar. So I know in pediatrics, people don't commonly prescribe Xanax pills, but as we all know, one Xanax, real Xanax, has never killed anybody. But the slide on the left, having been pressed to look like a real Xanax, might have some alprazolam in it, but it has been filled with other things, and about 20% of the time also will have oxycodone in it. Um, I don't know the level of frequency that young people get Xanax off of Snapchat, but I know it happens commonly. And also, I just heard a story about a young person. I was just at University of Michigan doing an event, and I heard a story of a young person who had a decorative pillow on their bed shaped like a Xanax bar. It was a pillow that looked just like this that said Xanax on it. I don't know, that's an anecdotal story, but I think that it is commonly known on college campuses that Xanax bars can make you feel good and that some people take them and drink a beer or two before they go out. Next slide. So on the right is one version of manufacturer's Adderall. The right is again the real pill. On the left is a counterfeit Adderall that was seized by the DEA. And the DEA publishes that also counterfeit Adderall in our country right now does have fentanyl in it about 20% of the time. So also cocaine, I mentioned, and cocaine being a white powder, often will have fentanyl in it. You can't taste or smell fentanyl in another substance. So cocaine being a white powder, fentanyl being a white powder, it's nearly or is impossible to detect fentanyl in a white powder unless you use some sort of reagent strip to test, which I'll go into in a second. So fake pills are commonly sold on Snapchat, TikTok, Instagram. And what commonly happens is that the person who's purchasing will agree to meet the dealer somewhere, or even the pills will show up in an envelope in the mail. So this is not hard to obtain from what young people have been telling me. The question I always get asked is why? Why would a young person, or I mean, why would a drug manufacturer who's trying to make a lot of money quickly want to run the risk of killing their customer? And no one really can tell me a great answer. I've just heard that in our current drug climate, drug landscape in this country, there are millions of pills being circulated. This is giant, big business, millions of dollars being traded, and you might be okay with a little collateral damage, which is obviously extraordinarily morally bankrupt and cold-hearted, but this is big business. I've also heard that because a lot of amateur chemists are making these pills and powders, that they might not be aware even of the ratios they've put the fentanyl to the real substance into the pill, and might not be aware even that it's harmful to their customer. Whatever the answers are, they're all extraordinarily unsatisfying. So what we need to do, and what we need to do quickly, obviously, is to teach young people about these counterfeit pills. We need to teach them about powders such as cocaine, methamphetamine. We need to teach them about ecstasy, also known as Molly, and about music festivals and how dangerous those tablets can be. And we need to teach them about cocaine because, as I mentioned, cocaine is wildly popular on college campuses. And when I talk to young people, I teach them in very honest and direct ways about what happens to your body when you take too much of an opioid. And that the only way you're going to survive that ingestion, particularly fentanyl, is if someone gets there in time with naloxone and if someone calls 911 quickly. And like I mentioned before, this education has to be given the same importance that we give education on vaping, seatbelts, drunk driving, safe sex. This has to be part of the conversation. And I know in a primary care visit for a well check, how aggravating it can be to have someone say, you need to add one more thing to your preventive list. But I would say, look at the numbers. And I didn't even mention, I'm sorry, I forgot to mention that last year the CDC published that currently age 18 to 45 in our country, the leading cause of death right now is fentanyl. So my suggestion or my strong advice is that this preventive healthcare advice needs to be moved up the list to number one. Because as we know, some of the stuff we counsel young people on often ends up being a very rare cause of illness or rare cause of death. And I just encourage you to move this type of education up your list. I'm hoping that the American Academy of Pediatrics and the AAFP starts to prioritize this type of education in all of their CME and published materials, but I haven't quite seen that happen just yet. So let's talk about fentanyl test strips. So we'll have time for questions. I'm going to move quickly. Next slide, please. And I want to be clear that as I speak to high school students, young people all over the country, by no stretch do I ever advocate for drug use or and never am I teaching them how to use drugs. What I'm trying to do with these test strips and naloxone is to arm them with every possible tool we have, and there aren't that many, to keep them safe in the environment they live in, which, as I mentioned, is a frequent place of pill and powder use relative to what it was 10 years ago. So this is a fentanyl test strip. On the left is the package, on the right is the actual strip. This is a reagent immunoassay strip, so it acts similarly to a COVID test or a pregnancy test. What happens is you dip this strip into a small amount of water, like the top of a 2-liter soda bottle, and in that water, a pill or a powder has been dissolved. And within 15 to 30 seconds, the water travels up the strip, and then you set it down on a flat surface and watch it for 2 minutes. And it will light up positive or negative, depending if the substance contains fentanyl or not. These strips are 92 to 96% sensitive at picking up fentanyl in any pill or powder. So not perfect, but as we know with COVID tests or other immunoassays, none of them are really 100%. So these are pretty good numbers, and I'm going to give you some information in just a second about how we keep kids safe from that small loss of sensitivity, which does worry me a lot, but 92 to 96% sensitive. And this is really the only tool we have in the game. So harm reduction is never going to be harm elimination. So this is all we've got. And we try to teach young people about these, and we try to give them to as many young people as we can. Sometimes in high schools, not always will they let us do that, but we pass them out pretty freely on college campuses. So this is the before tool. Next slide, please. And this is the after tool. Next slide, please. Oh, go back one, please. Oh, wait, I'm sorry. You were right. Go forward. Um, Real quick, this is just what we staple to each pill. It's a little card, and it gives the young person full instructions on how to use the test strip. The other flip side of this card will say testing powders for fentanyl. We pay right now about 50 cents a strip. We usually pass out 3 to 5 per student, but you can also get these on our website, mail order for free. We will mail 5 to 10 at a time to young people or anybody who wants them. All right, now next slide. Sorry about that. So this is naloxone. This is what I call the after tool. Sorry, there's a couple references there to Colorado. That's where I spoke last, but I'll tell you where to get these in Ohio also. So naloxone's available without a prescription at any pharmacy in Ohio. At the pharmacy, though, you'll have to pay for it. You can get it for free at any public health department here in Franklin County, and also from Harm Reduction Ohio. Harm Reduction Ohio will mail it to you for free. I would recommend that any primary care office has naloxone available and talks to it also about with any teen or any patient that is at risk for using substances or knows someone who uses substances regularly, or perhaps a young person who's heading off to college and living in a dorm or group setting. A lot of dorms are starting to stock this on every hallway, fraternities, sororities, and I encourage any young person living in a group house to just have it. Lots of college kids carry this now in their backpack just in case they need to be a good citizen, and I think that's amazing. I'm going to jump past this just so we can have time for questions, but we can come back to any questions about naloxone. Next slide. This is Cloxato, which is available now. It's an 8 milligrams, so double dose naloxone spray. It's not as widely available and slightly more expensive, but it's also available at any pharmacy without a prescription. So next slide. We have these two tools. We have the before tool, which is the fentanyl test strip. We have the after tool, which is naloxone. But I always tell young people, these 3 steps are your most important tool. This is your knowledge that's going to keep people safe. And I stress to them on this list that number 0 is just don't take anything in 2023. It's not worth it. It's too risky. And, currently the fastest rising age demographic for all deaths related to fentanyl are 15 to 25. Fastest rising for that demographic, fastest rising in communities of color. And number 0 is just don't do anything in this day and age. But if you do, number 1, always test everything you're going to take with a birdie strip, as we call them, or a fentanyl test strip. If your test is positive, throw your drugs away. Tell your buddies who got the same batch, throw your drugs away. If your test is negative and you decide to move forward with ingestion, number 2, you have to tell someone near you, a friend or someone, that you're taking something. Never, ever use anything alone in this day and age. They speculate that the fastest rising age demographic being age 15 to 25 is because young people are taking pills by themselves. So never use alone. Number 3, that person, your new designated driver, needs to know where the naloxone is. Number 1, always test your drugs. Number 2, always tell someone near you that you're taking something. And number 3, that new designated driver needs to know where the naloxone is. And I tell them, if you do these 3 things, I can't guarantee anything 100%, but I can nearly 100% guarantee you that you will survive a fentanyl ingestion in 2023. Next slide. Mary Lynn, are we finishing at 12 or 1:15 or at 1?
We can go till 1:15.
Oh, that's great. Thank you. So I want to move on to a couple other things, but I wanted to stress to you that as I travel the country, one thing I'm finding in this sort of brave, heavily burdened generation is that they're all really worried about this epidemic. They've all heard peripherally about it. None of them are getting education in their high schools. Parents are worried about it, educators, obviously. And one thing I would stress to you, that you might be in an exam room with a young person who may never use a pill or powder, but they all need this information because they have the ability in any concerning situation to be the hero. they have the ability to save their peers. And that's what I'm finding when I talk to young people, is that they want to be able to do that. So they need more information, they need more tools. And so I feel like as healthcare providers, we can be that conduit to get this information to them. And I worry a lot about this generation that, as you know, is struggling more with anxiety or depression, more ER visits due to suicidality or panic. And one thing that I'd like to take off their shoulders is this concept of a nebulous fentanyl epidemic out there that they also have to worry about. Because I worry about that kid that might reach for a pill or a powder to relieve the mental health struggle that they're having. So if we can teach kids about this epidemic, it might be one less thing that they have to feel a lot of stress over. And as a physician, as a mom, as a grieving mom, I stress to them that my advice in this day and age is just skip the pills and powders. This is what's killing people. Just stay away from them. It's too risky at this point. So I'm going to tell you a story about our name, and then I'd like to pause and take some questions if anybody has any. Um, so when Eli was in middle school, he and his buddies called themselves the Birdies, and we never figured out why. It was just a thing that stuck on and off through high school. So at his memorial service in our backyard, a lot of people wrote on these cards we put on the tables, "We miss you, Birdie. We love you, Birdie." And so when my daughter Olivia and I were naming our organization, we thought, let's pull that in. It's quirky like Eli. And so we did. And then I drew a bird with a canary, a canary with a light on his head. And I said, that's like the canary in the coal mine that goes down before the humans to check for oxygen, like just like the fentanyl test strips. And then I wrote out the word birdie light. And without even thinking about it, I looked at it and I said, wow, Eli, Eli is right in the middle of that name. And we weren't planning that. It just happened. And Eli is in the middle of everything we do. And I want you to take that with you, take his memory and to take this information and make it a priority to save lives with the information I've shared with you today. Um, Make it a priority to check out our website, follow us on our Instagram or Facebook so that you can see where we are on the move, what high school we're going to, what college. And the other important thing that you could do to help us is to make connections, to find that high school who needs our fentanyl education, to talk to principals, to talk to other healthcare groups or parent groups, anybody. We'll talk to anybody about fentanyl safety. So can you put up the next slide, which has all of our information on it? And please follow us. Please share widely. My email is beth@birdielight.org. So anytime you come up with any connection or if you want to ask me a more personal question, please feel free to reach out. I will pause there. I wanted to answer a question before it even comes up because I realized I didn't cover it. And when I was speaking, a lot of people are wondering about cannabis. A lot of young people will raise their hand and say, what about my weed? Does it have fentanyl on it? And this is a really hard question. There's a lot of media reports, news channels will advertise that fentanyl laced weed has been found. It's a really hard thing to confirm. It's pretty rare that the media reports come out. And it's a hard thing to confirm that that is actually happening or if there's truly been fatalities related to that. Sometimes they go back and look at it more closely and it turns out there might have been some fentanyl powder contamination on cannabis, but it turns out the person actually died from taking a tablet. So I try not to focus too much on the weed question, mostly because I don't have clear answers. But what I stress to young people is that it's the pills and the powders that are killing people. And that's really what we need to focus on right now. And once I have more data-driven information about the weed question, that's when we'll really start to pay attention to it. when they really try to drill me on this, I usually tell young people that if you have to use cannabis, that the safest way to do that is from a dispensary, because at least you know the production of it, and the organizational oversight is there for any kind of cannabis that's being sold from a dispensary. So not the best answer, but that's usually how I answer it when I speak to young adults. So I'll pause there, and I can look in the chat if there, well, actually it might be easy since it's a small group, if anybody wants to just ask a question or make a comment. I would be curious if anybody would, just for my purposes, type in the chat if they are already talking to young people about fentanyl safety, or if you feel like this would be a new concept for you. I see a question actually. Oh, okay. One question is, do you have any recommendations for handouts or resources that we can provide to patients during a well visit? I have some I can send to you that I think would be great. It's like a fentanyl fact sheet, and we can edit it a little bit to make it sort of that it's clear that it's coming to you from a well visit. So I can get that over to you or Marilyn. So I don't see much in the chat that people have actually been talking a lot about fentanyl in their well visits. So that sort of makes me feel great that we're sharing all this information. I think a good script as we wrap up here would just be really in a busy well visit to just say, sort of in a calm, non-judgmental way, as we all do, just ask patients, how much do you know about this horrible fentanyl epidemic? And if they, and sort of go from there, how they guide the conversation. And one easy thing to say would be just simply, do you realize that 2 out of 5 pills that are circulating right now on Snapchat or TikTok are laced with fentanyl, a lethal dose of fentanyl? And that might be, if that's all you can squeeze into a busy well visit, plus a handout, that might be worth it. Any other questions or comments?
Beth, do you know if, I don't know why I'm echoing. Do you know if like McKesson or our medical supply sells bulk test strips, or is that not a thing?
They weren't as of, I probably last checked like 12 months ago, but it's smarter to buy them in bulk. I get mine now from an organization called Dance Safe, and I switched over to them recently because they give a better bulk rate. But previous to that, I was purchasing from BTNX, and they'll give a reasonable rate as well, but Dance Safe just recently like dropped their prices. Anyways, you can order in bulk from both of those organizations, and those are the 2 gold standard test strips that have been studied the most in this situation. Sometimes there are strips sold on even like Amazon from sort of a rogue manufacturer, and there have been some comparison studies that show those are really not as sensitive as you would want. So Dance Safe or BTNX, I would just order directly. Or if there were ever a time where you would want in your office our strips with the instructions stapled to them, we could help with that as well. We're just using Dance Safe strips and then stapling instructions to them. So just for that kind of like printing and all that labor, we would increase the cost a little bit.
Yeah, that's great. It seems like, the kids that are getting ready to go off to college, like that would be a perfect thing as they're leaving the pediatric office. This is what you need to be safer.
Yeah, actually, and I think we had great success recently for the graduating class in Eli's high school at Bexley. I put out there to the graduating class group, how many of you want this care package for your kid going to college? And we made bags of Narcan and fentanyl test strips with instructions for them to take with them. All right. Well, I think that's it. Thank you everybody for listening, and please follow us on all those social media type sites so you can keep getting more information.
Thank you so much, Beth. And if you want to send me a handout possibilities, and I wrote down all the attendance so I can get that then forwarded to everybody who's attended, because I think that will definitely be a way to kind of focus the conversation in the exam room.
That sounds great. Yeah, I really appreciate this opportunity.
Okay, thank you.
All right. Bye, everybody.